What's up, Internet? All this healthcare stuff, debate, and whatnot going on about the federal government needing to provide healthcare or regulate healthcare. It's not the solution. It's never going to fix the underlying problem. Started under Nixon when he introduced the HMO. Him and his buddies, behind the scenes, trying to find ways to, pad their friends' pockets and their own pockets. And they came up with the HMO. Before that, health insurance was more of a major medical issues. It wasn't something that you had for day-to-day doctor's visits or everyday things. It was if you had to go to the hospital, and usually it was the hospital or the doctors, or you would pay for that. Today you have these concierge services or concierge doctors that basically do the same thing. You pay them a monthly service fee, and they just, they'll come check up on you every so often, or when you're not feeling good. A lot of them will actually come to your house. Of course, they're a little more expensive, but the people who can afford them, who are now being forced to pay for health insurance, who really didn't need to pay for health insurance because they had something else hooked up already, that's where a lot of people say, well, this is a tax break for wealthy people, because suddenly these taxes that under Obamacare were put in place, if they undo Obamacare, basically that means that these rich people are getting a tax break because now they're not paying these taxes anymore. It's kind of misleading when people talk about it that way, but essentially they're correct. It's not so much about taxes as it is about these health insurance regulations. And that's really a big part of the problem we have here, is that our health insurance plans, the way health insurance works, the way we pay for it, is so tied into our taxes because we have income tax. That's a whole other issue. If you got rid of income tax, a lot of this healthcare issues that we're dealing with would go away. But the real question is with this healthcare thing is, how do you take care of people who cannot afford healthcare, especially when premiums have been going up so drastically in the last couple of decades? Well, if you look at why they've been going up so drastically in the last couple of decades, you can find a real clear answer that, in fact, the problem is the government meddling in healthcare in the first place, specifically the federal government. So when the federal government basically says we'll pay out so much a year for Medicare or Medicaid, guess what happens? That's where the prices go. And the providers basically figure out what can we provide to that price. And that's what they budget for, that's what they shoot for, that's where the prices end up. Modern medical devices have been shown to be much more costly, and yet their benefits, their overall benefits, are only incrementally better than less costly or older style equipment. Third reason it's going up is tort, which is basically laws around lawsuits related to medical situations. What people's injuries from medical accidents or misuse or malpractice, what their injuries are worth. It's all under this tort stuff. These lawsuits and these payouts have caused medical doctors' insurance to go up, which means they have to raise their prices. And then we have the cost of schooling. We all know that's been going up like crazy, and a lot of the same factors are in play there as there are with healthcare. A doctor spends all this money learning how to become a doctor, and decades, literally decades of schooling and internships and fellowships and all this stuff that they've got to go through. It's expensive, and they get paid very little until they finally become a full-fledged doctor. To me, I hate to say the word fair, but it's fair that they make a decent wage or good living after having gone through all that, done all that to get to that point. So how do you lower healthcare costs? How do you keep people who can't afford it given them something that they can manage their healthcare problems with. First of all, you get the federal government out of it. There's nothing in the Constitution that gives the federal government that authority to be involved in healthcare in any way except for providing healthcare insurance benefits to the federal employees. Active military people, their healthcare through military trained medical physicians and medical staff and all that are on base or out in the field or wherever. And of course we have the VA hospitals that we all know the scandals for that. If they haven't been injured, if they made it through without any, serious long-lasting problems, you could probably make the case for saying, no, these people don't need to be covered anymore. They're able and willing to go out and work, mentally able, physically able. They can go out of work, they can go pay for their health insurance. But people who've been injured or had, mental trauma or physical trauma or anything like that, yeah, we should take care of them. And that's what the VA hospital should be there for. But maybe those VA hospitals should still be on base. I mean, I know that kind of limits access and whatnot in that way, but maybe it should still be the same thing where it's those enlisted doctors that are taking care of them to keep costs down. And if you look at the 10th Amendment of the Constitution, I think the 10th Amendment is like the most ignored, abused amendment of all of them on the federal level, because the 10th Amendment basically says the powers not vested in the federal government are vested in the states and in the people. And there's nothing in the Constitution that says that they can regulate healthcare or that they can provide these socialized health provisions. Now, if you want the federal government to do that, the proper thing that should have been done, 50, 60 years ago is to pass a constitutional amendment that very specifically outlines what the role of the federal government is. And we would have a much more stable law around how the healthcare is supposed to be handled. I'm not advocating for that. I don't think that's the right way to do it. So what do I think the right thing to do is? At the state level, you have county hospitals, state university hospitals, you have doctors that have to get licenses to practice and whatnot to show that they are officially a doctor. If you want to go see someone who isn't a licensed physician, but you feel they have some other skills that can help you, I have no problem with that. But I also like the idea of a doctor being licensed to be able to say that he's an actual doctor, to show that I went to school and I got the licenses and all that. And as part of that license, you could tell the states could tell these doctors, you have to volunteer a day a month or maybe a certain amount of money into a state infrastructure. And it doesn't have to be the best, highest, awesomest medical infrastructure in the world. It just has to be something to give people who can't afford the best something to get help. Like I said before, the best isn't necessarily all that much greater than other things that have been around for centuries. You don't necessarily have to pay all these high dollar amounts for prescriptions when there are other things that can actually help prevent you from needing those prescriptions. Now, don't get me wrong, if you have an acute medical issue that needs treatment right away, that prescription could save your life. But sometimes what you really just need is some education, some lifestyle changes. In the long run, you don't need that prescription because you're healthy. State infrastructure not being the best gives those people incentive to go get health insurance. That encourages personal responsibility. It encourages people to be self-sustaining, to not rely on handouts. People need handouts sometimes. I get that. I understand that. To say that they have a right to that medical care that is expensive and costs money and doctors' time is basically saying I can enslave that doctor and that hospital and that facility to give me that for free. It's not a right. But that doesn't mean we don't try to take care of people who can't take care of themselves. We absolutely should. And there are ways to do it that are a lot less expensive, a lot more affordable than having government get all meddled up into it. All they got to do is provide a basic infrastructure, basic guidelines, and let the market work? Yeah, I know people abuse the free market. I know it's taken advantage of. There are greedy people out there. There will always be greedy people out there. That's why we have laws. That's why we have law enforcement. But we've taken it so far to where we think we have to prevent everyone and anyone from ever having to deal with a bad thing in their life. Life is full of turmoil and strife. That's part of the way this world was designed by God, was to have challenges in our life. Don't take that away from people. Help them out. Certainly help them out. Help them not die. But encourage them to work through it and to get better and to become self-sustaining. And everything would be a lot better off for all of us. For those of us who can't afford health insurance, how do you get rid of those high premiums and all that? Well, I kind of like the idea of a healthcare savings plan. Unfortunately, it does tie back into our current income tax structure to encourage people to have that savings plan. But in reality, everyone should have some savings. Personally, I would rather have my employer putting money into a savings account specifically for healthcare that I pay my premiums out of, that I pay for basic, checkups and prescriptions and things like that for, because then when people are paying for them themselves that way, paying it out of pocket that way, yeah, that money is set aside for that, but they see the cost. Whereas if the insurance is paying for it, they don't really see the cost. And their insurance paying for it also causes it to go up because they have to have agreements with the insurance company. Your doctor bills the insurance company their amount that they're billing. The insurance company doesn't pay them that full amount. It pays them 50, sometimes only 20% of that full amount. And that is another big reason why healthcare costs are so high. Because they're trying to make up for what the insurance company, how much they're going to make them discount it. If you take insurance out of the day-to-day stuff and put it more into catastrophic, major issues that I know I can't afford to pay for, if I'm well off, I'm rich, maybe I don't need the insurance because I have a couple $1 million in a savings account somewhere that I set aside for medical emergencies. We need to change our whole mindset around how we deal with insurance, how we deal with medical issues, and who's responsible for what. And that's not going to happen with Trump Care. It certainly wasn't happening under Obamacare. And it wasn't happening before that either, because you can go all the way back to Nixon and the HMO. Peace.